Hi, are you suffering from a less aesthetically pleasing nose, which could be a deviated nose, a droopy tip, a heavy nose, a bulbous tip, sometimes in combination with difficult breathing, which may be due to a droopy tip or a deviated septum or other problems in your nose like enlarged turbinates? In that case, there's a solution to you. I'm going to explain you the techniques which we use, just a summary in a nutshell of such a procedure. And such a procedure usually is done under general anesthetic, sometimes under intravenous sedation, and it's usually taking between 1 hour and a half, but it may take much longer, up to 5 to 6 hours, depending on the complexity of the procedure. So now I'm going to explain you. So this is the profile which we commonly see. It's very common, this profile, where people have a hump and have a droopy tip. So in those cases, the tip must be supported with a little bit of cartilage there. And here, ideally, especially in the ladies, we will see a supratip break point. And then it's going to be straight. In men, it just can be simply straight. Straight in man is always good. But in females, a little bit of a slope is very well acceptable. So now I'm going to tell you something about the approach, about the incisions. How do we make the incisions? How do we reach the underlying skeleton of the nose and the cartilage? So there's two incisions. Either we can make all incisions at the inside, and then we're talking about a closed rhinoplasty. But sometimes, in some cases, we must have a very good view on the tip. And if the tip work is very difficult, which meaning that the cartilage in the tip is quite abnormal and you must do many changes, then some surgeons will find it easier to make a small incision, and that's usually a step incision. So it could be like this, a step incision, or it could be like an inverted V incision, which is initially a little bit visible, but when it's well stitched, it heals almost always inconspicuously and sometimes invisibly. And then the rest of the incision is actually at the inside of the rim of your nostril. So this dotted incision is not visible. So now I'm going to talk a little bit more about what we find under the skin, but basically a nose procedure is actually a remodeling of the skeleton of the nose, and the skeleton of the nose consists out of bone, which is the nasal bone, and then cartilage, the upper cartilage and the lower lateral cartilage. And these are very often a little bit abnormally shaped, and we must bring them into the right shape so that we have a good shape of the nose afterwards. So in many cases, when the tip is droopy, the tip must be lifted, and that's a very important step in the procedure. In those cases, this distance here must be shortened, so the cartilage must be shortened a little bit, and also the tip must be supported with an extra piece of cartilage, and we call this a support graft. You will find different words on the internet and in the medical literature, like septal extension graft, or columellar strut graft, or like theostrut. It's all a little bit comparable, it's all a little bit similar. The technical details, I can explain you during a consultation, but it's a little bit too much to explain you now. So here we've got the view on the septum of the nose, which is the middle wall of the nose. And when the septum is deviated, then we must do work here. So usually we will release the septum here, and then we can also remove cartilage here like this. And this cartilage can actually be used, for instance, to support the tip, and then we can place that cartilage here. So we can actually recycle the cartilage from the septum into the tip for support grafts, or we can use a spreader graft here to make the nose a little bit wider if the nose is very narrow. And so it's very important not to discard this cartilage, but to always try to recycle in the nose and find a good use to it. We also can put it here to support the nostrils if the nostrils are collapsing. So this is very important. A few quick words about aftercare. The cast usually 7 days. The packings usually 24 to 48 hours. Rinsing is always a good idea during days to weeks afterwards. And the stitches are in many cases or most cases dissolvable. However, it may be different from surgeon to surgeon.